Good afternoon, everyone. My name is David Williams. I'm a developer on the PhenX Toolkit, and today I'll be covering PhenX tools to facilitate data collection and data management. Yeah. All right, I want to cover a little bit of housekeeping before getting started. This meeting is being recorded. I ask that you please mute your microphone when not speaking and that you be mindful of background noise. If you have any questions throughout the presentation, I'll periodically give a chance to ask questions. Otherwise, put your questions in the chat and someone will get back to you as soon as they can. We'll be running a demo on the PhenX website. If you'd like to follow along by using the website on another screen of yours, feel free to do so. You will need to have a PhenX account set up. Otherwise, the demo will be running here, so you can still follow along here. All right, so the goals for today are to describe and show the various tools available on the toolkit, including the Share My Toolkit feature, and download files such as data collection worksheets, data dictionaries, and REDCap instruments. We will also go over how to import PhenX REDCap instruments into your REDCap project. Before I go into a bit of background about PhenX, I'm curious to see where everyone is from and whether or not you've heard of PhenX before. If you would kindly put in the chat your name, institution, and if you've ever heard of or even used the PhenX toolkit in the past. So with that, I will go ahead and move into background about PhenX. So you might already be familiar with these slides if you've attended previous workshops, but I want to emphasize these before going into the demo. The goal of PhenX is to provide the scientific community with standard measurement protocols for use in studies with human participants. PhenX is driven by the scientific community. The steering committee provides guidance on subjects to address. Working groups are convened to select protocols, and content expert panels review existing protocols on the toolkit. The scientific and broader community provide feedback through outreach, and the NIH Institutes and Centers liaisons facilitate communication between NIH and PhenX. Here's a list of current and prior funding from NIH institutes and programs. Multiple NIH institutes have supported development of focused collections of protocols to add depth to the toolkit. So here I want to take a minute to emphasize what PhenX is and what PhenX is not. PhenX is a catalog of recommended measurement protocols. It is a toolkit developed by the scientific community via a consensus-based process, and it's web-based. PhenX is not a new set of methods, ontologies, phenotypes, or exposures, and it is not a data repository. It does not cost anything to use. In short, PhenX provides protocols for researchers to use, and it's free of charge. So why use standard measurement protocols? Basically, study findings require validation. Using standard measurement protocols can also increase sample size and provide greater statistical power by allowing you to combine studies. Cross-study analyses increase the impact of individual studies. This can also increase responsiveness to funding opportunity announcements. Also, I apologize for the background noise. We're dog sitting at the moment. So here I'll cover criteria for selecting PhenX protocols. Steering committee set these criteria, and the working groups use these as considerations when selecting protocols. Okay, that's good to hear. Thanks, Laurie. So a standard protocol must exist. We don't develop new ways of asking questions. We rely on what's already in the field. Protocols should be clearly defined and already well established. They should be broadly validated, allowing them to be used with reliability and with reproducible results. Ideally, protocols should be low burden to both study participants and investigators. When possible, protocols that can be used across different groups of people are preferred, and open access and free-to-use protocols are also preferred. Prior use in omics research may be a consideration for some research areas. All this to say, use of this criteria means you might not find your quote unquote favorite protocol in the toolkit. All right, covering a few definitions before jumping into the demos. Domains are a field of research or topic with a unifying theme, where the theme may be a research area, disease, or condition. Domains add breadth to the toolkit. Examples include demographics, anthropometrics, and environmental exposures. Collections, on the other hand, go more deeply into a particular research area. Protocols in collections have a shared characteristic, target population, or topic, and may cut across research domains. Some examples include social determinants of health, mental health research, and sickle cell disease. A measure is a certain characteristic of a study subject, while a protocol is the specific way that the data is collected. So some types of protocols include things like a form like a survey or case report form, or an assessment like blood pressure or standing height. To illustrate the relationship between measures and protocols, an example of a measure might be pain intensity, while a protocol within this measure is the pain intensity child life stage questionnaire. And last definition before going into the demo, I promise, especially relevant to today's demo, is a toolkit. A toolkit is just a user's shopping cart of protocols. It is a collection point where users can gather protocols to use in a study, and when logged in, you can save these, take notes on them, and share with collaborators. So I wanted to get this all out of the way before going into the first demo, where I'll show, one, how I got all the protocols I have in this toolkit here in the screenshot, and how I will share this toolkit. Before going into the first demo, I just want to check and see, are there any questions up to this point? All righty. If not, I will go ahead into the first demo. So suppose I'm running a cohort with a few hundred participants. We've already got a study plan in place for assessing pain in sickle cell disease patients. However, I'm also interested in assessing how well these participants are adhering to their medication. I'm looking to incorporate this into our existing study. Basically, what this demo does is, I go over how to gather a few protocols, add them to my toolkit, and share it with my fictitious cohort by using the Share My Toolkit function. So I'm going to exit PowerPoint here and jump over to the PhenX Toolkit website at phenxtoolkit.org. So here at the homepage, since we're looking for protocols related to medication adherence, I'll go ahead and put that in the search bar up here and run a search for this. So this brings up a list of 30 protocols. I want to keep things simple and a bit more general. So I'll check the adherence to medication regimens protocol. If you're running this live along the side on another screen, feel free to add more protocols as you see fit. But today I'll just stick to the one, and I'll add this to my toolkit. So this brings me over to my toolkit here. I only have the one protocol, adherence to medication regimens. You can see here at the bottom, it says essential protocols are needed to interpret your data. Add all essential protocols to your toolkit. You can also see here on the right, there's essential protocols. One is listed medication inventory. Essential protocols are just other protocols that are needed to help understand data collected. So for adherence to medication regimens, we also need, well, it's strongly recommended that you add medication inventory as well. So I'm going to click here and add all essential protocols. This brings up medication inventory. I still have this notification at the bottom because this is introduced to more essential protocols. I'll just click it again, and now the notification has gone away. And now you can see I'm at the point where I was before the start of the demo. If you are following along on the website and you added more than one protocol to this, chances are, you'll end up adding more essential protocols to your toolkit. Okay, so now that I have my toolkit ready, how do I actually share this? Well, to do that, I have to log in. If you aren't registered for the toolkit, you'll need to click on register up here and fill out some information and verify your account just to start. Again, free to use, simple to do. I already have an account, so I'm going to click on login, and that should autofill. I'll log in, go back to my toolkit. I still have my protocols here, but now I have some more options. I can take notes, I can open other toolkits I've saved, I can save this toolkit, and I can now do the thing that I wanted to do, which is share this toolkit with my cohort. So I click on this, it brings up a form, and this, just 3 different fields to fill out, a name for the toolkit. I'll call it, medication adherence toolkit. Some customized email note. Hello, here are protocols necessary to assess medication adherence. And then finally, the user list, I just click add however many times for coworkers I'm working with. So I'll put it myself at domain.net. I'll put, colleague 1 at domain.net. And, once I've added everyone I'd like to share this with, I click save and share. And this will send an email to all the addresses listed. It'll have this email notice, and it'll have a link specifically to this toolkit here. So that way, even if they don't have a PhenX account, they would be able to see this, and we'd be able to incorporate this into our study. All right. Any questions up to this point? Alrighty. If not, then I'll continue on. So now that we've got our protocols to add to the study, I'll show some of the files you can download from the toolkit to help with integration into our existing study. So this helps with things whether it's, getting the questions themselves, adding validation or documentation. You would click on this download button here. So this brings up a drop down of everything we have. We've got reports. We have the protocols in PDF form along with translations. We have data collection worksheets, and we have data dictionaries. Today we're focusing specifically on the data collection worksheets, the DCWs here, and the data dictionary options here. The data collection worksheets are exactly that. They're just an MS Word document used to facilitate easy integration into an existing study. It's also got each, question and each data item listed out to be collected as described in the protocol. The data dictionaries go a step further and list each variable and metadata to be collected in the DCW. Depending on how you want to incorporate a data dictionary into your study, we've got 3 different formats available. We've got rich text file, CSV file, and a REDCap instrument. The CSV lists out each variable and its information in rows and columns. The rich text file is kind of a more readable form of this, and it's useful for epidemiological studies. And meanwhile, the REDCap instrument can be imported directly into REDCap. We'll go over that later as well. All right, so I'll go ahead and click download. In my browser, it'll pop up here. So it's just a zip file in the format file with a date timestamp at the end. I can click on this and go to my downloads folder, extract this, and I'll open up the older one here. And here you can see the data collection worksheets and the data dictionaries that we've all downloaded. And at the very bottom, the REDCap instruments. So clicking on a couple of these just to show what they look like. Here's a data collection worksheet for adherence to medication regimens. Again, this is just a MS Word document. It's 2 pages long. Here's the top part of it, with PhenX, and then some text about integrating this into your study, and then the protocol itself. It's 12 questions long in this table format. So what you can do with this is basically copy paste it into your study documentation. And for reference at the very end, there's a link to the protocol source on the toolkit page. We also have these in other languages. So if I go back to my folder here, we have it in Spanish. And same idea, it's just the protocol to use, and it's translated to Spanish. And then lastly, we also have a Chinese translation available. All right, so moving on to the data dictionaries. I'll go back to my download folder. I'll take a look at the CSV file of this particular protocol. So here's that. This is still the same protocol from the DCW that we just showed, except it's been discretized into rows and columns. So each row here is about a variable, 1 row, 12 rows, 12 variables, and each column is a metadata item. We've got variable names, variable IDs, the type of the variable, and then, the variable text and the values. If you're familiar with dbGaP, this data dictionary is already compatible with dbGaP data submission packets. So adding this to a data submission packet for dbGaP would be much easier. You can also incorporate into any data validation tools you might be using in your study. So this resource is available for that. Now I'll hop over to the RTF file. I'll open that up here. So again, here's data dictionary. This contains all of the same information as what's in the CSV file. So variable name, variable ID, domain, and description and type and all that. but this time instead it's in table format. So each table is a variable. There's 12 variables, 12 tables. This is a little bit more readable and, fits into documentation like with a code book. I believe this could be, copy pasted into a resource like that. So anyways, that's all I wanted to show with data collection worksheets and data dictionaries. So I'd like to move on to the last part of the demo covering REDCap. But just to make sure before moving on, are there any questions up to this point? All right. If not, then I'll move on to REDCap. So I'll go back to my download folder here. So the research electronic data capture or REDCap tool is just used to collect data for clinical and translational research purposes. It's easy to use. What you download from PhenX are these zip files that are compatible with REDCap, uh, software. Just to show what's contained within these, I'll open up this one here. You have two text metadata files, an author ID for PhenX, and an origin ID, just giving the protocol's ID. And then we have the instrument itself as a CSV file. This contains all the same information covered in the RTF and CSV files I just showed you, but now it's, enclosed within this zip file here for REDCap. So at this point, since we have these REDCap instruments available, I'll show how to put that in REDCap. If you already have access to a REDCap instance and you're following along with the demo live, feel free to log into your instance and continue. Otherwise, we're using an internal REDCap server to RTI. So I'll bring that up and log into that. If it ever comes up. Okay, here it is. I'll just log in. Okay, this is our project we have set up for the demo today. To add the zip file to your project, you just go along the left-hand side under Project Home and Design, click on the Designer button here, and this brings up your data collection instruments. I've already got a instrument added in here from before, so I'll go ahead and upload a different one. So to upload, you just click Upload here from an instrument zip file, brings up this, choose file, and it goes to your local browser. Okay, here's my download folder, and we'll add this top one. And I'll click Upload Instrument, and it was successful, great. And now we see we have another form here added to our data collection instruments. So I'll click on that just to show what it looks like in the designer. And we see this just has 2 questions in it. So that's really it as far as demoing in REDCap goes. So now I will go ahead and, well, I guess before closing out the presentation, are there any questions about, how we did this or anything about importing to REDCap in general? All right, I'll go ahead and close out. So I'd like to acknowledge the NIH leadership for this project, including Jyoti Dayal at NHGRI and the NIH leads for PhenX supplemental funding, as well as our steering committee and the hundreds of experts we've worked with over the years. I also want to acknowledge the large team from RTI that brings a wide range of expertise to support PhenX. And here we have a list of all the workshops in our series. This was number 4 out of 6, with our next one. Next one's coming on March 20th and April 17th. You can register for these by either scanning the QR code on the screen, going to the link below that, or finding the link on the PhenX Toolkit homepage. If you've missed previous workshops, recordings of these can be found on our YouTube channel. And this concludes the workshop.